So let me just go ahead and say this. I know that there's more than 2 types of diabetes. I know that, folks, okay? A lot of people, when I talk about type 1 and type 2, they say, well, you know that there's MODY, and you know that there's, you know, type 1.5 and all these variations. Yes, I absolutely know that. I don't need you to comment that. My name is Kim. I am a registered dietitian nutritionist, and today I have compiled a list of questions that I get asked a lot. So here are the answers to your frequently asked questions. But before we jump in, if you haven't already done so, please go ahead and subscribe to this channel. So the first question that I have is there a difference between type 1 diabetes and type 2 diabetes? Absolutely. So type 1 diabetes used to be called juvenile diabetes, and it is considered to be an autoimmune condition. It is autoimmune because for some reason, the body starts to attack the beta cells of the pancreas. And the reason why the beta cells are so important is because the beta cells are the cells that produce insulin. So you can imagine if the beta cells, if the body starts attacking the beta cells and render the beta cells inefficient, then that means that they cannot produce insulin. So therefore, when you eat something, insulin is not there to unlock the cell and allow glucose to enter the cell to be utilized for energy. And instead, all of this glucose stays within your bloodstream, and it causes your blood sugars to go higher and higher and higher and higher. So as I mentioned earlier, type 1 diabetes used to be called juvenile diabetes, but it is not called juvenile diabetes anymore because they're finding out a lot of people in their 20s, 30s. I even heard of a man in his 60s that was diagnosed with type 1 diabetes. Type 2 diabetes is a little bit different. Type 2 diabetes is known as insulin resistance, and it used to be called adult onset diabetes, but it's not called that anymore because even young children, I think I was reading a journal and there was someone as young as 6 years old that got type 2 diabetes. So it is insulin resistance, and it is more caused by lifestyle factors. So that's why sometimes when you go to the doctor, as annoying as it may sound, the doctor may tell you, oh, go ahead and lose weight, because the reason why the doctor may say that is because your weight may be a contributing factor to that insulin resistance. All right, guys, I had to get up for a second. I'm back. I had to turn on the AC because I live in Florida and it is hot outside. So what are normal blood sugars is the second question that I get asked a lot. So let me say this, everyone's blood sugar is going to be different, and it does need to be individualized. And the reason for that, I took a poll, and a lot of people mentioned, the majority of people I should say, that they believe that their blood sugar should be around 100 at all times. This is not accurate. This is not what the research is saying, because when you eat foods, it is going to be broken down into the body and your blood sugars are going to go up. Foods should not necessarily keep you at 100 or near 100 at all times. There is a natural ebb and flow in your blood sugar, and the scientific name for that is glucogenesis, which I'll get into another video. All right, so the next question I get asked is, what are the symptoms of having high blood sugar or hypoglycemia? And they may or may not happen in everyone. Let me just go ahead and say that. So the first one is, if you get a cut anywhere on your body, you may notice that your wounds are healing relatively slow. So slow wound healing is one. Another thing is men and women, but especially women, because we do have a shorter urinary tract anatomically, you may notice that you're getting frequent urinary tract infections. And the reason for that is because the bacteria that lives in your urinary tract, when it encounters those high blood sugars, hey, you become a whole entire snack. So those bacteria, especially the bad bacteria, they're feeding a lot of that extra sugar, and they're growing and they're multiplying, and they turn out into be a whole entire urinary tract infection. Another one is the 3 Ps: polydipsia, polyuria, and polyphagia. So polydipsia means that you have this excessive thirst. And the reason you have that excessive thirst is because, hey, you have all of this extra sugar in your body. The insulin is not working, whether it is insulin resistance or if, the cells of your pancreas have been destroyed. The insulin is not working to open that cell up to allow the glucose to enter in. So the body does not like to be in this state. So you have this excessive thirst mechanism, this quasi fail-safe to encourage you to drink water so that your body can urinate that out. And that is called polyuria. So we have polydipsia, which can create polyuria. And then also we have polyphagia. Polyphagia means excessive hunger. And the reason you do have that excessive hunger when you are diagnosed with diabetes is because, again, you don't have that insulin that is going to open up that cell and allow the food that you ate, which turns into glucose, to enter that cell to be utilized for energy. The next question that I get asked a lot is, Kim, what should I eat with diabetes or pre-diabetes? And to be honest with you, everyone is completely different. Everyone is completely different. Some people, I found in my experience, can tolerate certain foods that other people cannot tolerate. Not necessarily because there's a food allergy or a food sensitivity. It's just they can't tolerate certain foods. So this is what I say. You want to make sure on your plate that you have a protein present, that you have a carbohydrate present, carbs are not the enemy, and that you also have a fiber present. So I really like the healthy plate method. I think that is a great place to begin, especially if you have not yet spoken to a registered dietitian. So you may consider the healthy plate method that you see right here. It is advantageous for you to reduce your consumption of sugary drinks. I'm specifically speaking about sodas. I still find that a lot of people are drinking sodas. And I do come from the mindset of, I don't like to tell you to omit certain foods in your diet, but I'm gonna tell you to omit that soda. Because a lot of people like to replace water with soda that is full of sugar and not helping their blood sugars whatsoever. The next question that I get is, can I still eat carbs? Which I alluded to in the previous response. And the answer to that is absolutely, you can. So do not listen to everyone out here telling you to omit carbs from your diet. Don't do it. I highly encourage you, again, to see a registered dietitian nutritionist if you have questions about your diet. So carbs, especially whole grain carbs, do have that. They have B vitamins, they have minerals, they have phytochemicals, and they also have that fiber in there. And as is occurring according to our current dietary guidelines, it may or may not change. The average American is simply not getting enough fiber into their diet. It's like it's a fiber pandemic here. And fiber can help with a plethora of different things, ranging from the gut microbiome, for instance, which I have recently taken a interest in. So if you ever work with me, I may, tell you like, hey, I need you to focus on prebiotics, which is fiber, and also probiotics, which are found in your fermented foods. One of the most commonly known ones is yogurt. And that's because I'm trying to get the good bacteria of your gut to grow and flourish, because the gut is really, research is showing it's a gateway to our health. It is. The next question I get is, how often should I check my blood sugars? And again, it depends. I feel like all the time, I'm this guy right here when people ask me this question, because it really depends. Number one, how much test strips do you have? Do you have a continuous glucose monitor? Does it hurt when you prick your finger? So it really depends on the person. If I'm working with you and, one of the first things I may tell you to do is to go ahead and get a continuous glucose monitor, so you can just put it on your arm and call it a day. But if you don't have a continuous glucose monitor, something that I may encourage you to do is like, oh, okay, for the next couple of days, we're going to test your fasting. the next following week, we may test your 2-hour postprandial for dinner, so forth and so on. So again, it really depends on the treatment protocol that someone is on, and no two persons treatment protocol looks exactly the same. Someone mentioned, can diabetes be reversed? And I think I made a video about that already. That video should definitely be popping up now. So if you want to hear that information, if diabetes can be reversed, go ahead and click on this video. But guys, I thank you so much for watching. As usual, please remember to comment, like, subscribe, and share. And if you have any questions related to prediabetes or type 2 diabetes, please go ahead and leave them in the comments section below. All right, thank you so much. Bye-bye.